You're welcome to another episode of Meet the Practitioners on Health Africa, brought to you by the Association of African Universities in partnership with the Center for Pregnancy and Childbirth Education, CPACE. My name is Isabella Tetahenakwa, your host. Now, we all know the importance of the health of a mother and a baby during the pregnancy journey. That is why vaccination is recommended and crucial to both the mother and the baby. But then, misconception and fear always prevents the mothers from taking these crucial steps, hindering optimal health outcomes. In today's episode, we will delve into understanding the role of vaccination in maternal health. And with the help of our experts, we will discuss the importance of it, address some misconceptions, and also outline what mothers are to do and also expect. We will go for a quick break. When we come back, we will start with the discussions. Please stay tuned. You're welcome back from the break. If you just joined, this is Meet the Practitioners on Health Africa, and in today's episode, we are discussing the role of vaccination in maternal health, and we are happy to have here with us Dr. Genevieve Nsiedo from CPACE, and this is going to be her second time with us. If you missed our first discussions with her on neonatal jaundice detection and treatment, you can visit our social media handle, specifically YouTube, at Association of African Universities, to watch the full episode. Hello, Doc.
Hello.
You're welcome to Meet the Practitioner.
Thank you very much.
It's good to have you again. We miss you. All right. So today we are looking at the role of vaccination. Now, my first question may sound a bit weird, or you'll be like, why this question? I am asking because, during the COVID-19, we had a lot of stories and people being afraid, like how people were questioning how safe it is. So based on our main theme, which is maternal health, the question is, how safe is vaccination?
Thank you for the question. It's not out of place to ask that question.
Yes,
the simple answer is that, yes, it's safe to vaccinate. And just to explain it a bit more, when you get an infection, or let's say a germ enters your body tries to fight it. And will produce certain things to fight the infection. During that process, it takes some time for the body to defeat that germ. And during that time, the germ is also fighting you, so you can get sick and all that. But at the end of the day, your body defeats the infection. So the same way, vaccine is just a way of mimicking the natural process. Just at this time, you are not using the virus or the germ that causes the disease. You're using the same thing by using either bits of it or a weakened part of the germ. So when it enters your body, it's not going to cause the disease, but it will still make your body produce the things that can fight an infection. And then it will create a memory of that process. So that now when you actually face the infection, your body is ready. It doesn't now have to go through the process of learning how to fight the infection. The antibodies, all the things that are needed to fight that infection are ready to go. And so even though you encountered the real germ, you won't get sick. But this time you are covered. You are protected. So you don't get disease. You don't get sick. You have to be hospitalized and all that. So it's just the same process the body goes through, just that it's an efficient way where you don't get sick in the process.
And so with this explanation, then I'm beginning to understand that people are questioning its safety due to the symptoms they experience whilst the bacteria, the vaccine is fighting. Obviously, you're going to get some symptoms, and that is why people are, okay, what is happening to me? Is it safe? Is it because of what I injected? Right. So looking at mothers or pregnant women and the newborn, what are the benefits in terms of vaccination? What are they going to benefit from it?
Okay. So first of all, the vaccines will benefit the mother in that it protects the mother from infections. And then it also protects the unborn baby. Because when a mother has the antibodies and those protective things, it is transferred to the baby before baby is born. So by the time baby is born, baby doesn't have enough immunity against all the germs in the environment. But because mother has been vaccinated, those antibodies are transferred to the baby. So it covers the baby during the young period till his body matures enough to be able to fight infections on its own. So it protects both mother and baby.
As we are discussing the role of vaccination, we are looking at before pregnancy, during pregnancy, and even after pregnancy. Now let's look at the pregnancy journey. As a pregnant woman, what are the types of vaccination they need to get, and also its importance?
Okay. So there are different kinds of vaccines. In pregnancy, first of all, like I said, there are different vaccines. Each country selects the kind of vaccines it will give based on the diseases in its environment or what is common in the environment. So somebody in the US may not have the same vaccines that we would because of the different diseases that we get. But generally, one of the diseases that we are concerned about in pregnancy is tetanus, or babies getting tetanus. So mothers are vaccinated with tetanus and then diphtheria vaccine. So it's a combination. And it's to protect the mother from tetanus herself, and also to prepare the baby so that when baby is born, baby doesn't get tetanus. Because when babies get tetanus, it can be deadly. They can die from it. So most countries, and especially in Ghana, the vaccines that are provided for mothers during pregnancy is tetanus and diphtheria vaccine.
Okay, so these two
combined.
That is during the pregnancy stage.
During the pregnancy.
And when are they supposed to come in for this vaccine?
Okay. So the first time they enter the antenatal clinic, they are given. So that's your booking visit. Then you are required to take another shot 4 weeks after that. Then 6 months after the second one, you get the third dose. Then a year after, you get another dose. Then a year after, you get another dose. The reason is that the first 2 shots just protect you for 1 to 3 years. If you take 3 shots, it protects you up to 5 years. If you take 4 shots, up to 10 years. If you take 5, all the 5 shots, it protects you for life.
For life.
Yeah. So the more doses you get, the more protected you are, and also to protect your baby.
Now let's look at the side effects of these 2 vaccines. If a pregnant woman to come and then take these, let's say the first 2 or 3 doses, what are some of the side effects the pregnant woman should expect?
So just to explain the schedule, pregnancy is just 9 months, so you won't be able to take all of these. So most times, depending on when they start, they may just take 2 or maximum probably 3. That's if they started early. So the subsequent ones usually will happen after the baby is born. And to your question about side effects, so vaccines go through a rigorous process before it is churned out for human use. So most of the time it's very, very safe. Most side effects you would have is that, well, sometimes they are injections. The pregnant ones, they are injections. So you feel, it's a needle, so you feel some pain at the sides. There may be some tenderness or pain at the sides. Basically that. You're genuinely well. It's not something that would cripple you or make you sick, or there's nothing like that. That said, vaccines are also, it's like a drug. It can have a few times you have serious side effects like an allergic reaction, but those are very rare. And if it does happen, it is reported and investigated, goes through a whole process. But generally, it is safe.
It is safe.
Yes.
No serious side effects aside the pain from the needle.
Yes.
Okay. Now, so we are talking about vaccination. Are there any vaccines that pregnant women should avoid during their antenatal procedures and all that? Sometimes they may go and self-medicate. They'll go to a pharmacy and say, I need this. They will even tell the pharmacy, this is what I want. So maybe advise us, or let us know, give us more insight as to some of the vaccines we should prevent when pregnant.
So I initially said there are different types of vaccines. So there are vaccines that are prepared from germs, live germs, just that it's been weakened so that it can't cause disease. So we call that live attenuated vaccines. Those vaccines we don't give pregnant women.
Okay.
The vaccines that pregnant women will get are either also prepared from a germ, but it is killed completely, like it's dead. Just that because it still has the proteins and whatever, it will cause your immune system to react to it. So live vaccines are not given to pregnant women. It's also a special type of vaccine. That one was prepared not from even a live germ virus. It's actually prepared, we call it messenger RNA. So it is not actually made from the virus. It is synthetically kind of made to mimic the proteins of the virus. So it is actually safe in pregnancy. Yeah.
All right. So we are done with the pregnancy stage. Now let's look at the child, the newborn. What are some of the types of vaccinations that are required for the baby once he or she comes out?
Okay. So, like I explained earlier, when a mother takes vaccines, she produces certain antibodies that are transferred to the baby so that the baby is protected in the first initial months of life. But those antibodies the mothers give to the baby wane over time. So that's why baby also needs to be vaccinated for themselves to build up their immunity. So there are various vaccines we give the children. I mean, a long time ago in the 1970s, we started with like 6 vaccines, but now children take as many as 13 vaccines. And we are actually even advocating for other vaccines to be added on because, like you see, different diseases keep popping up. So at birth, we give the babies vaccines for BCG. That's to protect them against tuberculosis. Then they also take a vaccine for polio. I don't think you've seen you've heard anybody complain of polio nowadays because we are giving these vaccines. Then they also take a hepatitis B vaccine. So at birth, they get vaccines. Then at 6 weeks, they get another set of vaccines. At 10 weeks, they get another set. 14 weeks, they get another set. Then there's a sort of a break a bit till 9 months. Then they take another vaccine, another set of vaccines. And then at 18 months, they also take another set of vaccines. Some of the vaccines are pulled together as one shot. So we have what we call pentavalent vaccines. So that means it contains 5 vaccines and it's given as one shot, just so to make it a bit more easier for the babies so that they don't get too many pricks. So this is the schedule we have in Ghana. And the diseases that it covers are, like I mentioned, tuberculosis, hepatitis B, diphtheria, pertussis, whooping cough, tetanus, things to prevent pneumonias, meningitis, measles, rubella, yellow fever, a host of diseases. And because of that, we don't tend to see some of these diseases in our lives now. And that's even goes to the point saying that as newly trained doctors, sometimes you hear some diseases, but you've never actually seen some before. So when it does present, if people stop vaccinating and we now get these diseases happening, we may actually not be able to get diagnosed it properly because we are not used to such drugs, such diseases.
That's very true. Now, we will go for a quick commercial break. When we come back, we will look at some of the side effects of these vaccines and also address some misconceptions.
Sure.
Please stay tuned. We'll be right back.
Hello Africa is a live breakfast show that aims to give you, our viewers, an informative, entertaining, and energizing start to your day. This isn't just another news show. It takes the form of vibrant magazine packed with news reviews, lifestyle features, engaging interviews, and interactive segments that put you at the center of the action.
All you have to do is grab your coffee, get comfortable, and join us for the Hello Africa morning show.
We are here to kickstart your day with the news and stories that matter to you, alongside all the fun and inspiration we crave.
Every morning, join us for
the latest headlines in African higher education, science, and
quick and informative newspaper and online news review,
lifestyle tips on fitness, nutrition, fashion, and beauty,
inspiring interviews with influential figures and everyday heroes,
performances and interactive contests, and so much more.
In Ethiopia, Salam Africa.
In North Africa, Alan Afrikia.
In Swahili, Jambo Afrika.
Hello Africa, your daily connection to the continent. You're welcome back from the break, and this is Meet the Practitioners on Health Africa. Today we are discussing the role of vaccination in maternal health with Dr. Genevieve Nsiedo from CPACE. Before the break, we looked at the various vaccination for pregnant women and newborns, as well as its importance. We are continuing the discussion, looking at first the effect of these vaccines to babies. Hello, Doc.
Hi.
Thank you for sticking with us. Yeah, so before we went for break, like I mentioned, you mentioned some of the various vaccines for babies, as well as the schedules for them. So now let's look at the side effects, or what babies are expected to experience after these vaccines.
Okay. So, well, some of the vaccines are given into the mouth. Some are given as injection, either in the shoulder or on the thigh. So just like any injection, it can cause pain. So babies will cry because they are having the vaccine. Some of them would have fever after the vaccine is given, but it usually resolves. So most of the time, the nurses would advise the mothers to give paracetamol. If, however, that fever persists beyond a day or two and the child seems unwell, then you'd have to bring the child to hospital. Then we'll have to decide whether it's the vaccine or it's actually that the child is unwell. Yeah. But generally, those are the side effects that some children will have: fever, pain, excessive crying because of the pain. Yes.
And then what would be the remedies for these should a baby experience this?
So that's what I mentioned, paracetamol. Yeah, paracetamol is a pain relief, and then also an antipyretic, so it will bring down the temperature, and then baby will be happy. And then breastfeeding, because breastfeeding is also a form of pain relief for the baby. So if you continue breastfeeding, the babies will calm down.
Okay, so I'm still on the side effects. I remember when I was very young, I saw a mark here, and I asked my mom. I thought maybe I fell or something cut, and she was like, "When you were a kid, they vaccinated. That's why you got this mark." So, with these vaccines, which of them cause? Because to me, it's a side effect because it's giving me this mark.
Interesting.
Yeah.
Okay, so I mentioned that at birth, one of the vaccines that is given is BCG to prevent tuberculosis. So BCG is given on the shoulder. So, and then yes, it can cause a little scar there. And actually, it's one of the things we look for as confirmation that you've had the vaccine. Yes, it's not. Most people would have it, a few people won't, but we kind of look out for it to be sure that really the baby has been vaccinated. Yeah.
So it's the needle that causes that scar?
No, it's the reaction of the body to the vaccine that causes that, not the needle.
This is good to know. So we've discussed vaccination during pregnancy and after pregnancy to the newborns. Now, I would want to know, so you mentioned during the tetanus, for the tetanus vaccination for pregnant women, they can even go back after they've given birth. Now, aside that, are there any vaccines for mothers after childbirth?
Okay. So not necessarily after childbirth. For any adult, you're also prone to infections. So I mentioned that when Ghana started their vaccination, they started with just 6 vaccines. So those who were born in the 70s and 80s had those vaccines. But the children of today are getting like 13 vaccines. So that means if you're born prior to the introduction of these vaccines that they are giving the children, then you, the older one, have not been vaccinated against such vaccines. So things like rubella was not part of the old vaccines. Things like meningococcal vaccine were not part. So if you find that just to remain healthy as an adult, you want to take those vaccines. Those vaccines will not be given to you as part of the national program, like the way is given for pregnant women and the children. So you would have to go out and seek those vaccines. So some of them will come up when, let's say, you are traveling or you are going for some program outside. They will insist that you have those vaccines. And especially for rubella like this, it's a vaccine that you can't take during pregnancy because it's a live vaccine. So you'd have to take it outside pregnancy. And it also has its implication because there are some women who get rubella infection during pregnancy, and it has consequences on their children because the child can be born with congenital heart disease, eye problems. So if you've already vaccinated yourself, you kind of protect your baby during the pregnancy. So there are other various vaccines that you can go for
But
outside
that
pregnancy.
should be determined
Your
by
own,
you.
yes, because it's not part of the national program. It comes at a cost, so you have to take the initiative.
Thank you very much for the clarifications. Now let's. I know that CPACE, you do very well when it comes to educating mothers and pregnant women as well as families, and I know you've encountered a number of people who are saying me vaccination due to misconceptions. Now, if you can share with us some of these misconceptions you have heard from these mothers and also debunking them.
Okay. I think in Ghana, actually, we do well with vaccination, but with the influence of social media and the information age, a lot of things are coming in. So some time back, somebody did a research and thought that vaccines is associated with autism, and it became a big thing. But then people went back into that research and debunked it, that it wasn't really, there was no association. People have also talked about the fact that the vaccines are now so many, and then if you give too many vaccines at a time, it will cause a problem. But none of that is true, because the kind of germs we are exposed to in our environment is more than what we are actually even targeting with the vaccines. So basically, most of the myths that we get are not true. Vaccines are totally safe. And if you look back, like I mentioned, polio is a disease we don't see nowadays. Measles is really gone down. Even things like diarrhea, because we are giving rota vaccine. The kind of mortality the kind of deaths that we were getting previously, now children are living, they are surviving better because of these vaccines. And then in countries where Western world, who even started with these vaccines and had gone to a high level of almost everybody getting the vaccines, when these myths and things came in and some people decided, I won't take vaccine, I won't take vaccine. Now they are having recurrence of these old diseases popping up in their countries. That's something that we don't want to get there. So vaccines really protect us, and it has huge benefits. One, you remember during COVID, a lot of people get sick and they are flooding the hospitals. Now we had to ask people not to come to the hospital, because if you have a flood of people getting sick from one particular disease, they won't have the resources to take care of the other diseases. So it reduces burden on the health facilities in terms of these infections. And then some of these diseases actually cause, like polio, it can maim the child. Your leg would get paralyzed. You have to be in a wheelchair. Things that this person could can do now is cut short. So it can maim the child. And then unfortunately it can also kill. So vaccines prevent all these. And I don't see with the kind of benefits we get from vaccine, to say that we won't give, and then just because of the pain or the little fever we'll have, we won't go for vaccine. So I really encourage everybody, we need to go for the vaccines.
Yeah, very true. Talking about misconception, I remember during COVID-19, just like you mentioned, the materials used to be the mRNA. I remember they made mention it's going to change your DNA, and even pregnant women, their children are going to have different DNA and all that. I believe these are all not true.
They are all not true.
So far as research findings are saying this is safe for mothers and children, you should go for it. And I know this is also a challenge, preventing mothers from going to or doing the right thing. Now, aside this, what are some other challenges you've heard from these mothers to preventing them from going for vaccines?
Well, like I said, in Ghana, we don't face a lot of challenges with people accepting vaccine. I would say maybe it's up and coming youth and yes, who maybe because they are wide read, they think they've read something, and instead of seeking clarification from the right source, will just go with that. So most people actually accept the vaccines that are given during antenatal. I think the challenge is that people coming for antenatal, because these vaccines are given during antenatal. The vaccines for the children is when you come for the child welfare clinic. So I guess that's why sometimes they do mop up and then go around the various homes to do mop up, and then so it's about like getting more coverage with the vaccination, and people also coming for the antenatal and the child welfare clinics, then we are covered. If not, the other thing too is that sometimes people deliver in one place. They go to maybe their grandmother or mother's place to deliver, and then they take their first 1 or 2 vaccines. Then they travel somewhere, and then they forget all about vaccination. They forget to follow the schedule. And I think maybe on the part of the health workers to now have to find a way to trace every baby, so that even if you start from this corner of the country and you move to another corner, we can trace you and say, okay, you started with this one, you have to complete this one, so come forward like that.
And identifying these challenges, what specifically CPs, what are especially people coming for antenatal and all that, so what are you doing to encourage?
That's a huge question. I don't think it's the responsibility of one particular person. It's actually all of us. One, we need to raise awareness. Two, the government needs to provide the vaccines. Vaccines are expensive. If you decide to go for a vaccine for yourself, then you know how much expensive it is. But government, through donor partners, provide the vaccines and make it available. I think the other bit is about, like I mentioned, the coverage, sending people out there so that we actually trace and make sure that everybody who needs the vaccine actually gets the vaccine. And I also think that we all have to take personal responsibility for our health, because it's to prevent diseases. You would get sick. If you don't take the vaccine, your baby is not protected. So we all need to take personal responsibility for our health. The other bit I would also say is that there's something called herd immunity, which means that if a lot of people take the vaccine, it kind of gives a general protection to everybody else, because some of the vaccines are such that certain groups of people can't take. Like I mentioned, a pregnant woman can't take a live vaccine. But if there's herd immunity in the community for the other diseases, then she's covered. So it's like your health concerns me. So we all need to come together and push for the vaccine, go for the vaccines, and then take care of each other.
Yeah, exactly. Thank you very much, Dr. Ntiedo, for sharing this impactful insight with us. Now, before we wrap up, what will be your words of encouragement and last word to expectant mothers and also to our families?
Okay. I would say that vaccination is important. It is safe. If you have concerns, please speak to a health worker. If you take a vaccine and you think you're having any reaction or untoward reaction to it, please speak to your health worker and get the appropriate advice. Don't what was the word, stigmatize or brand the vaccine as terrible, because it really does have huge benefits, not just for yourself or your child or your immediate family, but for the whole country and even the nation as a whole.
Right. Thank you very much, Doctor, for joining us today, and we hope to engage you in the next episodes.
Sure.
All right, this brings us to the end of today's episode, where we discussed understanding the role of vaccination in maternal health. I'll use this opportunity to appreciate the government for making these vaccines accessible to our mothers, and also encourage mothers or expectant mothers to heed to the right schedule for these vaccinations. See you again in our next episode. My name is Isabella Teta Hinakwa. Have a nice day.